Thanks very much. Yep, it's true. I'm going to be talking about the Red Cross work in food security. Hopefully I can get that to come up. Otherwise, you'll have to close your eyes and imagine what I'm talking about. And before I start, I'd like to pay my respects to traditional owners of the land, elders past and present, and Aboriginal people who are with us here today. And I also want to acknowledge the work of Red Cross team in the past and also currently, and particularly Jennifer Evans and Renee Gui, who've worked hard to pull this talk together with me. I just happen to be the storyteller about the work we've been doing. Our vision is that all people will have the food that they need for a healthy life. And today what I'm going to take you through is a story a little bit about the type of work that Red Cross does in food security and the way that we do that work. A review that we had about that work and how it was going in tackling the issue. Developments we've made since we've had that review and how we've changed our work a little bit. And some of the ambitions that we're still working on to try and realise this vision. So particularly the work around advocacy, which we're still working on to try and engage ourselves in a sustainable change. So the nature of our work has changed a lot over the last 100 years, and Red Cross has just celebrated its 100th birthday. But something that hasn't changed is our mission to address disadvantage and vulnerability in Australia. We're focused on building stronger, more resilient people and communities. And sadly, poverty and inequality have increased in Australia, so they remain an entrenched part of people's lives, particularly for those in the most marginalised groups. You've got to press it really strong. Our work in food security over many years has been really diverse, and it's an area of work that's changed as the issues that people face have changed to putting food on the table. It's clear that the work that we do in food security is an important part of the work that Red Cross does and something we'll do for a long time, because it's an issue that affects a large number of the people that Red Cross works with. So to give you an idea, we work in 7 different priority areas, so working together as partners with Aboriginal and Torres Strait Islander people is one part. Tackling entrenched locational disadvantage, areas that have had intergenerational poverty. Addressing the impact of migration, something we'll hear about in the other sessions this afternoon. Overcoming exclusion and building bridges back into society for people who are isolated. And some other areas that are a little bit more outside the scope of this, but our work in emergencies, which is what a lot of people know Red Cross for. Our work championing the international humanitarian law, Geneva Conventions, that type of thing, and our work in aid and international development. At Red Cross we have a ways of working, so it sets out the core values of the way that we'll work with people, both individuals and communities, and it's about the fact that we think that the way we work is just as important as what we do. And I'm just going to spend a little bit of time going through how a couple of these relate to our work in food security. So the first is about building on strengths. So we've heard from some of the speakers today about how people with a lived experience of poverty and food insecurity have usually developed skills and resources to deal with their situation. And we think it's really important in our work that we understand these things first and that we build on them. And certainly that we try never to undermine those skills and resources. Another part is about embracing a community development approach wherever we can. So something that builds on the long-term skill and capacity of communities and trying to work in a genuine partnership where they've got ownership over the program. And finally, acting on evidence. So having a clear aim and a logical flow about that the activities that we're involved in are going to have a beneficial outcome on people who need it most. And then the flip side of that is the fact that we need to contribute to the evidence as well. So we need to use the evidence and contribute to it by evaluating what we do and writing it up in terms of our pilots and programs and sharing them. In 2002, we had an internal review of our food security programs. The idea was in an effort to better understand the impact that we were having and the issues that were being faced in the community. It was a really comprehensive review. It involved lots of different processes and stakeholders, so going to 39 different programs in over 20 locations in metropolitan, regional and remote Australia. What the review revealed was that we had a really committed team of staff and volunteers who were really passionate about working in food security, and we still have those staff and volunteers today. It showed that there was a lot of capacity, will and commitment within Red Cross to work on food security, But there'd been a bit of a limited focus on the structural factors that were underlying the issue, so the potential for really long-term and sustainable change seemed to be a bit unlikely at the time. So after this, there was a really deep push to get involved more deeply in advocacy in the field of food security, so that we could make some sustainable change and try and make some difference to those underlying issues. It also talked about us needing to try and be involved in leading in the field of food security, given we did have a national scope, to try and boost the expertise internally and develop our staff skills and capacity, and also to be innovative and use our resources better. So I'm now going to speak to some of the changes that we've made following on from the review, and then I'll go into a bit more detail on advocacy, which is the tough one we're still working through. So we've embedded a 3-pillar framework, which is the idea is to ground our work across the 3 areas of availability, access and utilisation, recognising with this there was a need for stability across all those things to ensure food security. And the concept of how livelihoods shape these factors, so the physical assets, the social assets, political assets, etc., that people use to maintain their daily lives. The aim of the 3-pillar framework is around reducing this emphasis that we'd often had on the supply end of the food security spectrum, and recognising that we needed to aim our advocacy efforts more in areas of food access and food availability. The framework is also a key part of our internal food security policy, and we've got copies of this available on the table for Red Cross outside, so come and grab one if you're interested. You can also get it off the website. There was a really strong emphasis from the review to engage with other people and other leaders around food security, to advocate for the upstream changes that we knew we hadn't quite been hitting the mark on yet. While there's still a really long way to go on this, one of the main achievements we've had is we've partnered with the Dietitians Association and the Public Health Association to work on a joint policy statement around food security for Aboriginal and Torres Strait Islander peoples. And again, we've got copies on the table out the front. Some of the other things we've been working on in this field, we've submitted we've made submissions to the National Food Plan, the inquiry into remote stores, and more recently the audit into remote food security. And other examples are the work by our New South Wales team working with the Sydney Fair Food Alliance on things like this. But we've still got a lot more to do in terms of leadership and partnership, so working with small local organisations and particularly working with Aboriginal-led organisations to make sustainable changes through community actions. Enhancing our internal capacity has been another focus that we've taken since the review, and so that's around developing our staff. So we've held internal forums to bring teams together from across the country about sharing experience and resources and stories, and we've also brought in external experts from time to time as well. We use the resources that we've got to try and provide the best professional development opportunities we can within our resources, things like role sharing, training, conferences and forums. And the teams have also been recipients of internal innovation grants where we've used them to trial and pilot new and exciting activities around food availability and access pillars. Another thing we've had in terms of a win in terms of developing our staff is an internal scholarship that enabled a staff and volunteer member to go to the Netherlands to an international food security conference, as well as visit the British Red Cross Emergency Services Logistics team and the largest food bank operator in the UK. Another part of what we're doing is making more of an investment in working with Aboriginal and Torres Strait Islander communities around food security, where childhood malnutrition is of urgent concern. We're employing local people to work on local issues. Our work in Galawinku in the Northern Territory, where we're working on infant underweight and anemia is one of these areas, and also some emergency relief work we did in Freegon, right up in the north of South Australia. These are 2 areas where we're starting to show some outcomes from working well with local people and having local ownership of programs. But we've still got a lot more to learn in this area, partnering with Aboriginal and Torres Strait Islander organisations and people. Another area we've been working on is staff training and development across the organisation, so getting out into broader areas. Excuse me. So trying to work with emergency services, work with migration support programs, working with people exiting the justice system, trying to get the food security reach across the whole organisation because it is quite broad what we're working in. We've made significant progress in our work with migration support programs. developing a range of resources, programs, and also conducting research on food security in this area. And we've got a talk on that tomorrow afternoon, 2:55 in room 4, I think. And the talks this afternoon are also around this area. So I've mentioned we've had some great achievements and developments since the review, but one of the strongest messages that came through was about getting deeply involved in advocacy to address the underlying issues. I guess much like some other public health challenges, we can't rely on behaviour change or individual relief programs to make sustainable differences in food security, although they're important as well. And particularly not for people on the margins, so we need to start working on the bigger, more structural issues around income, around food supply. So advocacy is also one of our ways of working from the slide I showed earlier. And our statement on advocacy says that at all times when we do advocate, we'll be persuading decision makers to act on behalf of vulnerable people. We'll use appropriate tools and actions to advocate and ensure that what we do is based on evidence and, importantly, is in line with the Red Cross Red Crescent movement. So while we've now got a policy statement on advocacy and a policy statement on food security, it doesn't mean we're automatically ready to start advocating in food security. It's a really tricky area. The potential is really clear to make a difference using advocacy, but the big challenge is obviously the depth of factors that contribute to food security that we've been hearing about all day. So it's really quite a wicked problem, particularly in remote communities, and there's no quick fix. This quote from the Anglicare Hard Choices report demonstrates the reality of what it's like, the lived experience of being in poverty and experiencing food insecurity, and gives us an insight also into determinants of food security. So it says that lived poverty is the embodiment of hard choices. Households living on the margins experience significant levels of deprivation. They choose between having enough food to feed their families, securing stable and affordable accommodation, and paying utility and medical bills. Experience is one of isolation, social disconnection from family and friends, and a significant struggle to protect children from the worst effects of poverty. So in taking on the major recommendation to deepen our advocacy efforts, which has been a really gradual process, not one that we've raced into, there's 3 helpful tools that we're using to try and plan and think through an advocacy plan for Red Cross in food security. So the first one is a model from Sandra Carlisle, which is a model around health promotion for advocating on health inequalities. I'll go into more detail shortly. It's sort of about how you'd advocate, who would advocate, and what sort of purpose you're advocating for. So it sort of segments the work a bit. The second model is from our friends at the Public Health Association. So based on their advocacy experience, which they do a lot of. And you might have heard Michael Moore talk about this in other talks that you can access online, or he's done around the 10-step process of evaluating. So about creating urgency and creating a need, building a guiding coalition to work together, and so forth. And finally, a focus on partnerships, which we're hearing a lot about today. But really the idea of recognising that even though we might have divergent food security groups that act on different areas, there are times that we need to come together at an opportunity and use our strengths and partners. So I'm just going to go now into more detail of the model that's on the left. So same model, different picture. So it's Sandra Carlisle's conceptual model for advocacy in health promotion and health inequalities. And we think it's a reasonable fit for the work that Red Cross does because it helps us to see the potential that advocacy can make and who can work in each area. So it's broken up into 4 quadrants, but really on the left, it's a facilitational style of advocacy, and on right is a representational style. So to break it down, representational is sort of advocacy on behalf of people. So that's our high-level policy statements and talking to government about ways to impact food security. Whereas on the left, facilitational. So working with small community groups to identify issues and act on them. And what we've done around the outside is just map some of the activities and projects that Red Cross is already involved in. Ideally, where we want to get to at Red Cross is that we've got a strong mix of advocacy actions happening across the organisation in all these sectors. So that what we're working towards is advocating for healthy public policy up there in the right-hand corner, where we've created a supportive environment for people to be able to make choices about their food intake. liaising between different interests around health benefits for vulnerable people, and enabling people in the community to have the information to act themselves and have some skills and resources to do that. And as you'd imagine, this is a pretty significant shift from program delivery. So our progress in developing an advocacy plan and acting on it hasn't been fast. Considering the various types of advocacy that we would like to engage in and will engage in, we're going to need to equip staff differently. From program officers who are working in small communities to create community actions, through to working with executive directors who might be at the table with ministers both at federal and state level, and then recognising the different jurisdictional issues for food security around income or transport, and the fact that some sit at state level and some sit at national level. So where we need to get to is being able to resource everyone in the organisation to be able to play their part in advocating for food security at the level where they have influence. So what are we doing next? We're taking these 3 different models and other useful information to try and pull together an advocacy plan for Red Cross in food security and provide some structure and influence to how we're going to influence change makers in this field. By developing an advocacy plan, we're going to need to use better research, and more research needs to be done. Things around measuring food security, which we're hearing about more and more, that if you don't measure it, you don't know the scope of the issue or how it's changing. Also research around the effectiveness of interventions that already exist. And to support the research, one thing we're really keen on is having more practice evidence from the ground. So similar to what Joel was saying with New York, by acting in advocacy and policy, but also having service delivery, you can use them to feed into each other and create better effects at both ends. We realise we're going to need to develop a change vision and communicate it effectively. So thinking through what social determinants do we want to act on, and what are the changes that we want to see this year and in 3 years and in 10 years, because it's a long-term issue that requires a long-term plan. But at the same time, we need to appreciate our limits. We're not going to get real results on this acting alone, and nor would we want to act alone. We really need to develop influential partnerships to tackle these structural concerns, something that everyone is saying today. It's clearly the case. Because food security is the kind of issue that's not going to take one battle. It takes people acting on it from many different sides over many different years and in many different ways. So forums like this are a really good opportunity to come together and build a movement, and what's really important is that we sustain that movement. So what I've tried to do today is talk you through our journey with food security, the type of work we do, the type of work we're changing, and our push towards trying to be better in advocating for food security issues. We've learnt a lot in this process since the review, but we've still got a long way to go, and there's always more we can do. So I guess our call to action today is, if the vision that we're talking about and the process we've talked you through is of interest to you, if you're interested in working in the same way, then we'd be really interested in hearing from you to be part of this advocacy journey to help put food on the table. Thanks.